In a 2023 Centre for Diseases and Control Prevention, that is a CDC report, over 1.3% of Americans suffer from mecfs, equal to about 4.3 million people, costing the US economy $17 to $24 billion in lost income and medical bills. Worldwide, pre-pandemic, as many as 17 to 24 million people were estimated to have mecfs. I suspect these figures have doubled since the onset of the SARS-CoV-2 pandemic.
Yep.
Less than 1/3 of US medical schools have mecfs on their curriculum, and I would estimate that a similar proportion of international medical schools are in the same position. It was not on my medical school curriculum, for example. In your opinion, with this amount of suffering and economic cost, why has the medical profession ignored this debilitating disease?
I think a big part of it is because it's invisible. The Canadian government did a census in 2017, and that report's available online. But the Canadian government estimates that just over 5% of the population fulfills criteria for chronic fatigue syndrome, fibromyalgia, and multiple chemical sensitivities.
Wow.
So that's 1 in 20.
Wow.
And I used to do an exercise with my students, and somebody was smart enough, they actually turned it into a paper. I should have thought of it myself, but what I used to do with students is I used to say at the beginning, let's do a free association exercise. Tell me what comes to mind when I say chronic fatigue, fibromyalgia, and invariably they would say psychiatric, psychological, not real, frustrating to take care of, and there's nothing you can do for them. So when I have students come and work with me, I have 4 goals. I don't care if they remember the medications, they can always look that up. What I want them to know is it's real, it's not psychiatric, it's extremely rewarding to take care of, and there's lots that you can do. So those are the 4 big misconceptions. And that's why many of us were really surprised with long COVID, seeing these articles. What is this long COVID? And what's happening to these patients? We've known about this for decades. This is just simply post-viral syndromes. And we've seen these post-viral syndromes. Physicians love to give new names. There's something called post-chikungunya syndrome and post-Ebola virus syndrome and post-Lyme. And what do they present with? Fatigue, pain, sleep disturbance, brain fog, and unexplained symptoms. And so these are just post-viral or post-infectious conditions. There's a big study done I always want to make sure I pronounce it right, Dubbo in Australia, where an infectious disease clinic prospectively looked at the infections that came to their clinic. And invariably, regardless of the infection, 10% of people went on to fulfill criteria for chronic fatigue syndrome at 6 months, regardless of the infection. And so what they're saying is that this is not the infection, it's the host response to the infection that leads to these conditions. And that's why many of us knew that it would be around 10% of patients who would develop a post-viral syndrome after COVID. And those numbers keep coming back over and over again, around 10% of patients who have COVID. And in terms of the cost to society, when Canadian Census did their estimate, less than 45% of those patients who are afflicted with these conditions who filled out the census were working. So it has a huge economic impact, both at the personal and at the societal level. So you would think if it's real, and if it affects a huge number of patients, and if it has a huge impact on the population. So you're probably familiar with the term DALY, D-A-L-Y, daily adjusted life years. It's a way of comparing diseases in terms of their impact on society. And MS, chronic fatigue syndrome, and AIDS have almost an identical DALY. However, the amount of money that was spent, and if you look at like what the average is based on a DALY, MS gets the right amount of money, $100 million. AIDS gets more than its share at 5 billion with a B, and ME got less than its share at 5 million. So this is prior 2015, this is 2013 data. So 3 diseases with the same impact on society. One gets 5 million, one gets 100 million, and one gets 5 billion with a B.